Good day, my dear postgraduate students. Welcome to the class on Glide the Slide. Last class, we had given you a homework. It was a simple slide for diagnosis. And I hope you people have made the diagnosis or at least a differential. Nevertheless, let us see what is on the screen. Apart from other things, I am finding a large cell with a mirror imaged appearance. And I also find that there is some kind of an enlargement of the nucleolus. Cytoplasm, nucleus, nucleolus. So what can the diagnosis be? This we shall be seeing in Glide the Slide 11. The probable differential diagnosis that I should have in mind as a postgraduate student would be, say, an Anishkosin. Where do you get it? Good. Rheumatic heart disease. That can be kept as an exam slide, particularly if your examiner is a very senior person. Reed-Sternberg cell, of course, we come across quite frequently. But then there is another fellow called the cytomegalovirus, which is an inclusion. So which of these does it fit into? So this is one of the first differential diagnoses that I'm seeing over. So I find that there are some cells having a caterpillar distribution of the chromatin. These are the Anishko cells, which I had mentioned earlier. So this is a caterpillar, and this is the pattern of the chromatin which I am seeing. Even otherwise, it is a large vesicular nucleus within which I am finding. On the other hand, I am finding a lesion with a pleomorphic population, and the organ or tissue cannot be identified. So I am finding some histiocyte-like cells, some lymphocytes. This my professor would like to call as an effacement of architecture, in which I am finding a large cell with a large nucleus, another a few large cells. If this is doubtful, look at this. I am finding a range of cells, binucleate and a mirror image. This is multinucleated. Again, there can be some cells which are called as the mummified cell. Some can be unicellular also, the lacunar cells. So look at this one, classical. So I'm finding a large nucleus with a prominent nucleolus. So this is a mirror image of each other and classically described as the owl-eyed appearance. Now, does our homework fall into any of this? It is a case of cytomegalovirus. The size can be anywhere between 150 to 200 nanomicrons. It is an enveloped organism. Icosahedral to spherical in shape. And the genomes can be linear and non-segmental. CMV, cyto means cell. Megalo is big. And virus itself means poison. So cytomegalovirus. Obviously, we know the fate of it. It comes from the family of Herpes viridae. The German pathologist Hugo Ribet in 1881 was one person who first identified it and described the enlarged cells with enlarged nuclei. Then these people isolated the cytomegalovirus. And finally, in 1990, the draft or a publication was brought up. This is a simple schematic diagram in which I am finding the glycoprotein, that is a nuclear membrane. And then there is the nucleus, in which very simple forms of the double stranded DNA is present. So this is one of the lesions again. I am finding prominent endothelial cells and then There are the RBCs. It can be anywhere, highly vascular or even an alveolus. Leave alone the tissue. I am able to see again a large cell, large vesicular nucleus, prominent eosinophilic nucleus. Classical. If you're not convinced again, look at this one. And this tissue, I hope you are able to identify. I'm finding polygonal cells in radiating cords. It's a liver in which there is one cell showing a viral inclusion within the nucleus. This is the story of the life cycle. It starts from here. So there is a virus, and then it gets attached to the receptor onto the cell membrane. Any virus, as I had been telling you people repeatedly, cannot multiply on its own. It requires you and your cell. So what happens is it undergoes an uncoating. It loses its own cell wall or membrane, and then there is an entry after the uncoating. And if it happens to be an RNA, there is something called as a reverse transcriptase. It will be converted to a DNA. If it is a DNA, it can be entering the host cell as such. DNA is mandatory for multiplication. And look at this one. The DNA gets replicated, and these get integrated within the host cell. So this is the way. And when the host cell of the nucleus keeps multiplying, so do the virus. And there is an end point at which the virus, the nuclear egress is seen. It comes outside. And having come outside, it can use any of our cell membrane or the organelles to form its own wall. And it is being again released. The virus exits the host cell by nuclear egress and budding. That is what we are seeing here. So it thrives. The advantage here is once it is inside your cell, it is protected from all the immunological and phagocytic aggression. The transmission of the virus can be by saliva, urine, and genital secretions. Sometimes it can come from the mother to the child. What are the manifestations as such? This I am just telling you for the sake of completion. The moment we get some slide or something, better to know something about it. Encephalitis, meningitis, retinitis, blindness is quite common, pneumonia, myelitis, prolonged cytopenia. Any viral infection, there will be a cytopenia. Exacerbation of the ITP. Sometimes there can be death. Severe colitis is another manifestation. Mental retardation and delayed milestone is again a classical feature. And one virus that it has to be differentiated from will be the Epstein-Barr virus. That I have deliberately cut so that we concentrate only on the cytomegalovirus. Now, what are the investigations? One is PCR. Secondly, in histopathology, you are seeing the classical inclusion bodies. The differential diagnosis clinically can be the EBV or the infectious mononucleosis, viral hepatitis, or the herpes virus. These are the differentials we should be having in mind. I had mentioned that in the last class, you can go back to it. And look at this. It is literally thriving over it. And what are the conditions which can predispose to the flourishing of the cytomegalovirus? It can be an organ transplant. Obviously, there will be a lot of immunosuppression that has been created so as to prevent any graft rejection. Therefore, the patient can go in for the cytomegalovirus infection. Any form of immunosuppression on its own. HIV patients were known to be having it. And so also the administration of steroids or anything else. And in pregnancy from the mother to the fetus. This much is fair enough. Earlier also I had conducted something on the viral inclusion bodies, which can be a question. This is a repetition. So I would like you people to kindly go through the entire list. And intranuclear, it can be acidophilic or basophilic. Cowdery A type and B type. And the acidophilic can be seen in the varicella, herpes, yellow fever, and polio. Whereas the basophilic will be seen in adenovirus and in cytomegalovirus. That is why we are finding a blue colored inclusion that is there. We shall glide to the next slide. Slide number 12. A 43-year-old male presenting with sudden onset and progressively increasing intermittent seizures. So this is the history, this is the slide. As I told you earlier, you people can refer, discuss, go to your teachers, net, whatsoever, come back with the answer and the material behind it. We shall be seeing in the next class.